pain in the neck. It's more than just an expression reserved for annoying friends and co-workers. Approximately 80% of people will have severe neck pain at some point in their life. And our necks work hard for us every day, whether it's supporting or stabilizing the head, assisting in chewing, swallowing, breathing, talking. But when the pain strikes, it can have a truly adverse effect on our everyday lives. It can really produce a problem in any type of our functionality. Today, we'll address some of the most common and not so common causes of neck pain, such as degenerative disc disease, spinal stenosis, and discuss treatments, as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon, and let's start things off with a question from our Facebook account. This one is from Joey. Joey asks, "Hey Doc, I was playing hoops with the guys, and when I went up to grab a rebound, one of them accidentally knocked me to the ground. Next thing you know, I can't move my neck because it was killing me. I went to the ER, and the guy there told me I had torticollis and I should wear a neck brace. What the heck is torticollis? And how long will I need the brace?" Joey, it's actually pronounced torticollis or torticollis, but regardless, thank you for the question, and I'm sorry you are in pain. So torticollis essentially just describes muscular tension that's asymmetrical that results in your neck being sort of stuck in one position or another. It's common when we have a neck spasm, and if before you started that game, you didn't have any neck pain, and after the trauma, you now do have neck pain, then it's reasonable to say that what you have is post-traumatic neck pain. Don't let that freak you out. Most of the time, pain that starts after exercise does get better on its own. Now look, if your pain continues and now you notice that you can't play basketball, you can't sleep, you can't enjoy your quality of life, then you need a deeper sort of evaluation, maybe even an MRI. Ask your doc for an MRI if you continue to suffer. And then ask your doc as well about a steroid pack. Sometimes just 6 days of steroids avoids you from having to take weeks and weeks of non-steroidal anti-inflammatories. But I don't mean to give you a diagnosis over the show. So if you continue to suffer over a week or so, definitely talk to your doc. Thank you again for your question. Our next question comes to us from Pavel, who reached out to us on our very own website, allhealthtv.com. Pavel asks, "Hi, Dr. Brusovanik. My neck's been hurting for a while. So my primary guy wants me to go see a spinal surgeon because he thinks I might have degenerative disc disease. What's the key difference between degenerative disc disease and other neck ailments?" Oh, look, and he signed "Do svidaniya," which is how you say goodbye in Russian. And I'll respond in Russian too. Здравствуйте, Pavel. Здравствуйте means hi. That's really a good question, and thank you for reaching out to us. So, if you've had pain for a while, neck pain, then you may want to see whether you have some of the associated findings that will really clue you in to whether it's truly neck pain and not something else. For example, neck pain is associated with pain deep behind and under the shoulder blade. Sometimes neck pain can even cause mid-back pain. Neck pain can be associated with pain going down the arm, pain behind the jaw, facial pain, as well as headaches. Now, stiff neck, difficulty moving one's neck obviously is part of neck pain as well. But you'd be surprised to see that as your nerves exit the spine, you'll find that pain can go wherever that nerve goes. So you can find pain all the way down to your fingers. And if that nerve is compressed anymore, you'll find that there could be numbness or even weakness in your hand. Those are usually the red flags that bring a patient to seek help. So look, Pavel, just because you're going to see a spine surgeon doesn't mean that you should end up with an operation. Always try conservative care with new onset or chronic neck pain. And what is conservative as compared to surgery? Well, physical therapy may be reasonable. Non-steroidal anti-inflammatories may be reasonable. And a short course of steroids, as in tablets, may be reasonable. Finally, injections. It may seem like an aggressive step to some, but an injection is just a way to deliver your medicine properly and very precisely. You can avoid having the medicine go all over the body, which could have deleterious effects, and you could achieve maximal local concentration with a shot. So I strongly believe that before anyone rushes into surgery, definitely try an injection. And by the way, Pavel, if you do end up getting an injection, and after the injection, you have no relief, remember, that means that the injection was at the wrong spot, because if your neck pain does indeed come from your neck, from one of your discs, if you were to put a drop of numbing medicine, your pain should be gone. Now look, the relief may not last, but you should at least have a few hours of relief. So don't get discouraged, even if the first injection doesn't work. I hope this helps. And on that note, because you asked such a great question, there are also there are a number of things to consider when you're having neck pain. There are a number of conditions that can cause neck pain. So causes of neck pain, not in any particular order, but as comes from common web knowledge sources: muscle tension and strain. Remember the patient who called in after playing basketball, getting knocked down can cause strain and muscle pain. Now remember, that pain should get better. And if you've been suffering with that for a few months or over a year, then it's no longer because of that accident. Then chances are there is something deeper, like a degenerative disc, that's now causing chronic pain. Number two, poor posture. Now look, as we age, we do tend to sort of lean more and more forwards. And in order for you to keep your eyes on the horizon, you then have to lift your head to look at the horizon. So this chronic extension is associated with a lifetime of poor posture. If you feel like your posture is not good, and that's why you have neck pain, evaluate your neck first. Don't blame your posture, because remember, posture comes from inside. It isn't your fault that you have become more flexed forward, or perhaps if you have a curve in your back. Don't blame yourself for poor posture. I remember my mom used to jam her finger up my back so I would sit up straight. There's some great evidence that there's no benefit to forcing yourself to sit in upright posture. Your muscles will just fatigue, and then you'll go back to the posture that your skeleton essentially demands. Okay, enough about that. Whiplash injuries can cause neck pain. Now, a whiplash occurs when someone is driving or standing still and get hit from behind usually. Then their head will go forwards in an aggressive way and backwards in an aggressive way, and that can produce some serious neck pain. Now, if you have had neck pain before, or if you have degenerative discs that perhaps were not associated with pain from before, then a whiplash injury can actually exacerbate that pain. As the energy travels through your neck, the healthy discs will allow the energy to come right through, but bad discs will have some of the energy settle and may make that chronic neck pain even worse. Now look, heart attack, number 4, is an important cause of neck pain, and especially if it's on your left side. Don't ignore sudden onset of chest, neck, arm, and even jaw pain, because that can be a heart attack. And if you're having a hard time breathing, or if you feel like your heart is really racing, definitely call 911 and get to a doc as soon as possible. And meningitis. Now, we commonly see meningitis in a younger population, especially viral meningitis, and I'm talking about college-age kids. They will say they have neck pain. They'll have other findings like fevers, not all of them, but that's common. And they'll also say that when they bend their necks down, they get this terrible pain going all up and down their backs. If you consider meningitis, definitely get to the ER as soon as possible. On to the further causes of neck pain. Number 6, rheumatoid arthritis. Now, back in the day, an orthopedic doctor's office was filled with patients who have rheumatoid arthritis because it would cause such severe deformity and pain. Now, with the new medications, we can prevent most of these patients from having neck problems. But if you have a history of rheumatoid arthritis and you have neck pain, remind your doc to get some x-rays, specifically x-rays taken from the side where you bend forward for one shot and then backward for the other shot. One of those old textbooks lessons that I'll never forget is that patients with rheumatoid arthritis can develop instability between C1 and C2, the two vertebrae at the very top of your spine, and that can cause paralysis. So if you have rheumatoid arthritis and you have new onset neck pain, definitely tell your doc that you have that underlying condition and remind them to get those x-rays. From the point of view of number 7, or osteoporosis, it's the same rationale. If you've had fractures, especially mid-back fractures, that may be associated with worsening posture, a need for more extension, and new neck pain. So if you do have osteoporosis, especially with a history of fractures, definitely talk to your doc if you are having neck pain. Now, fibromyalgia is my very favorite topic when it comes to neck pain, because so many people who have neck stiffness, headaches, shoulder girdle pain, will be diagnosed with fibromyalgia. Now, look, I may be an outlier with that regard, but I don't believe in that diagnosis. I think that it has become a diagnosis of exclusion, meaning that if a doc can't diagnose your pain, then they'll say you have fibromyalgia. And especially women get diagnosed with fibromyalgia more than men, because oftentimes fibromyalgia in the eyes of some of these docs is associated with being hysterical. And there's some blame that is very unfortunate when you see a woman crying, insufferably crying, saying that no one's been able to help me for years and years. That's not hysteria. That's just a patient who has been improperly diagnosed. And if you look up fibromyalgia, there is neither a classification, nor outcomes measures, nor an effective medicine. There aren't even studies to prove fibromyalgia. But I'll tell you this, if you have neck stiffness, shoulder girdle pain, headaches, and jaw pain, and you've been told you have fibromyalgia, ask your doc to get a neck MRI. And don't be surprised if you remember me, because I'm telling you, chances are extremely high that it's not fibromyalgia. It's a disc in your neck that's causing all of these symptoms, including facial tingling and jaw pain, some of the lesser known findings that some docs may not know of. Look, I'll be honest with you. When I was in med school, we spent a total of maybe 2-3 hours on all musculoskeletal conditions. So if I'm a primary care doc who doesn't see neck pain often, or who is discouraged from getting MRIs for patients due to various insurance restrictions, you may find yourself in that situation years later, suffering from a wrong diagnosis. So remember, those of you who have fibromyalgia and neck pain, please ask your doctor to get you a neck MRI. Okay, on to the next point, spondylosis. Now that word just describes arthritis. It's sort of a medical word for arthritis. And if you have spondylosis, that means you have some degenerative changes. You need more information than that to diagnose your problem. So it behooves you to push your doc, ask your doc to get you a neck MRI. Now, osteoarthritis essentially is the same thing as spondylosis, but a herniated cervical disc is something else. Now, especially young people, just like in the lower back, can develop a herniation in a disc in their neck. The disc may tear, the inner content of the disc will sneak out, and then the patient will have a terrible pain in the neck or pain going down the arm. This isn't imaginary, even though there's nothing wrong visibly with the arm. That's a real problem, and these patients definitely deserve an MRI. Now, spinal stenosis, which is the next possibility for pain, describes tightening of the canal for your nerves. And if you have spinal stenosis, then that's why you have pain going down the arm or even behind the shoulder blade. Now, if the stenosis gets real bad and the spinal cord becomes compressed, then you got to think about things like balance issues, hand numbness, hand clumsiness. And if you find that you have those findings, that's another reason to please seek a reasonable, educated opinion from a spine specialist and make sure you get a neck MRI. Now, congenital abnormalities can cause neck pain as well. For example, Klippel-Feil syndrome, where patients will have fusions between multiple vertebrae in their neck. You'll see this interesting webbed appearance of the neck, but that's one of the more rare findings. Tumors. Now, I have had patients who have come to me with neck pain and were then diagnosed with lung cancer at the top of their lung. Sometimes these are called hilar lung cancers, can cause shoulder blade and even neck pain. So if you find that you are having neck pain and you are losing weight, definitely seek care. Cancers of the spine can cause neck pain as well. But for every 1,000 metastatic cancers or multiple myeloma, there'll be one cancer of the spine. So I hope you don't let these scary lists really freak you out. Now, Clara reached out to us on Instagram, and here's her question. Hi, doctor. My spinal surgeon performed all the standard tests, and her diagnosis was cervical stenosis and recommended surgery. I recently turned 75, and although I'm in severe pain, I'm not in a rush to go under the knife. Are there any other treatments you can suggest? Hi, Clara. I'm sorry to hear that you're in such pain. So, cervical stenosis is a bit of a problem. And it's a problem because sometimes we fail to correlate the findings on your MRI with how you feel. Now, many patients will present to the doc and an MRI will find that their spinal cord is tight or the nerves have very little space. If you're not having symptoms from this, specifically numb hands, painful upper extremities, balance issues, then seek a conservative spine surgeon who will be willing to observe you and not push you into surgery. This problem goes a lot further because many surgeons will see a tight cervical canal and they'll tell you, if you don't have spine surgery, you'll be paralyzed. Or if you go over a speed bump too fast, you'll be paralyzed. Or if you fall in a shower, you'll be paralyzed. Now, back in the day, that was the official sort of statement. But nowadays, we have great research. Specifically, Jonathan Grauer, a very well-known spine surgeon out of Yale, published a paper showing that we don't need to worry about being paralyzed just because our nerves are a little tight or the spinal cord doesn't have all that room. If your spine is stable, you are at no additional risk for having worsening spinal cord compression that results in a neurological problem, unless you have something underlying like instability. Don't let your doctors push you into spine surgery. And if you hear those words, please get a second opinion. In case you missed it the first time, here's another opportunity to find out exactly how to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back to Ask the Doc. Sean has a question through our website, allhealthtv.com. Sean's question is, hey, Dr. Brusovanik, I'm hoping you can help me. I've got neck pain that goes up behind my ear and also gives me headaches. I tried doing research online, but couldn't figure it out. Sean, neck pain combined with headaches is obviously no party. I'm sorry you're suffering. Now, I can't diagnose you over the show, but I'll tell you this. Neck pain coming from C5-6, which is one of the more common discs in your neck to deteriorate, will reliably cause jaw pain, facial pain, and headaches. In fact, most cervical discs, when they degenerate, can cause headaches. Ask your doc to get you an MRI, and then you'll be able to see exactly where the pain is coming from. Thank you for your question, Sean. And to all those out there, if you find that your doc is delaying the MRI, please don't hesitate. I'm happy to send you a prescription. We've got another question from allhealthtv.com. You should really check out our site if you get a chance. It's chock full of really important information. Irina asks, "Hi, Dr. Brusovanik. I was diagnosed with rheumatoid arthritis a number of years ago, and it mostly affected the joints in my wrists and knuckles, which was manageable. But lately, I've been feeling some kind of pain in my neck. Is it possible to get RA or rheumatoid arthritis? And if so, what can I do?" So yes, rheumatoid arthritis is a systemic problem, and you can get it anywhere, in your hands, in your legs, or in your neck. I'm very to hear that you're suffering from RA, Irina, but these days, your rheumatologists have some really good solutions that may be able to avoid you taking very deleterious or dangerous medications like methotrexate or steroids. There's some really benign medications that can help you. Now, before I share my thoughts, let's check out this video from the Mayo Clinic.
Painful and swollen joints, deformity in the hands.
Deforming arthritis is one of the signs of rheumatoid arthritis.
Dr. Eric Madison is a rheumatologist at Mayo Clinic. He says rheumatoid arthritis is quite different from the more common osteoarthritis.
It's an autoimmune disease, which means that the immune system is overactive for some reason that we don't know and decides to attack the lining of the joints, causing inflammation in the lining, which leads to damage in the joint structures, the cartilage, the bone.
There are medications to help slow the disease and offer pain relief, but not a way to prevent it. Dr. Madison says early treatment is important.
Rheumatoid arthritis untreated leads to severe joint damage. It actually shortens life expectancy.
For the Mayo Clinic News Network, I'm Vivian Williams.
Irina, I hope this video was of service to you. Definitely seek a rheumatologist or a spine specialist and make sure they get those x-rays from the side with you bending forward and backward to make sure that your rheumatoid arthritis has not caused some kind of instability. Okay, we have a YouTube question from Yolanda. "My mom used to always tell me to sit up straight, don't slouch, and you'll thank me someday. You know what? I probably should have listened to her. My neck's been bothering me lately, so I went to my doc, who said I have poor posture. How can it contribute to my neck problems, and what are some tips to improve it?" Yolanda, thank you for reaching out. That's a really great question. Look, posture will contribute to your neck pain in its last stages, when it's hard to look up straight because of associated flexion or gibbus or kyphosis. As of today, if you are young and you're having neck pain and you have poor posture, it very well may be that the two things are unrelated. Make sure your doctor does a good physical exam when he or she evaluates you. I hope this helps. You've got questions, we've got answers. And just in case you missed it the first time, here's how to submit your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Chuck sent a question. "Hey Doc, I was renovating the patio in our backyard a few weeks ago when I heard my daughter scream because she saw a big spider. I whipped my head around way too quickly to see what was going on and wrenched my neck, and it's not getting better. When should someone seek medical attention for neck pain versus trying at-home remedies?" Chuck, that's a really great question. It's smart that you're proactive. Look, if your pain gets better, you don't need to do anything. But if you're suffering with chronic neck pain, it's now been months or years, then I think it's reasonable to consider one of two approaches. My favorite approach, which is the conservative approach. Talk to your doc, get a diagnosis, and either try physical therapy, some medications, or an injection. Now, if you continue to suffer and you are looking to correct the problem, then it's reasonable to talk to a surgeon. Most cervical spine surgery involves what's called a fusion surgery, where we insert little cages and metal plates that will essentially immobilize the spine. You see, if I try to squeeze it, there's no motion at all. Now, back in the day, that was our only solution. But the problem with that is that other discs will start to deteriorate. So if you are in pain and you are finally ready to get it corrected, make sure you ask your doc about something like this, which is disc replacement. Now, this allows motion. And even though it doesn't seem like a lot of motion, that's how much that disc would have moved under normal circumstances. If you continue to suffer and you decide to do something about it, disc replacement will avoid you having problems at other levels. So if you do decide to speak to your spine surgeon, make sure it's somebody who is well-versed in cervical disc replacement. And if they tell you a bunch of stories about how you're not a candidate, please get a second opinion. Again, I want to thank everyone for joining me on Ask the Doc. I appreciate a lot of these personal questions. And remember that your questions are probably very similar to questions that hundreds or if not thousands of other people have at home. So I appreciate your question, and so do the viewers. Please continue sending them in, and please join us again next week on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.